In every family and every community, there are strengths. These strengths reside in the heart and spirit of community members, and especially in their families. This is a story about a program that draws upon these strengths to improve early childhood development and family health. The Maternal Infant Health Outreach Worker Program, MIHOW. MIHOW is a home visiting program staffed by trained community women and sponsored by local organizations. MIHOW's outreach workers promote healthy living among pregnant women and families with young children up to 3 years of age. As experienced good parents themselves, they lead by example as they educate about nutrition, health, and children's development.
They're there for you, to give you information, to educate you on your body, on the development of your child, and to give you your self-respect, and to give you self-confidence, and to trust yourself.
One young mom that I'm doing home visits with wanted to get her GED. Child care and transportation was a problem for her, but through MIHOW and home visiting, she is receiving her GED through home studies. That helps her as well as her children because they see her at the table doing her work and study. It will enable them, and they will want to sit there with mom and do their work as well, so everybody will be benefiting.
Especially the younger girls need comfort. They need someone to talk to, just to have simple conversation with about questions that you may not ask anybody else, or that anybody else may not even take the time to tell you. This is undivided attention to you.
Neighborhood clinics, child care centers, and other nonprofit organizations make ideal MIHOW program sponsors. These local organizations are uniquely able to recruit strong women from their communities. These are MIHOW's outreach workers, women who are committed to their community and trusted locally because of their energy, integrity, and compassion. And because these women come from the same backgrounds as the families they serve, MIHOW workers easily develop trusting relationships necessary for effective family support. Outreach workers and group leaders receive extensive training in the basics of prenatal and infant health and the milestones of development. They also receive training in communication skills, family dynamics, and mentoring. This training prepares them to provide services to families in their own homes where they feel most comfortable and secure. Outreach workers serve as powerful role models for women who may be struggling with poverty or isolation. In their home visits, parents gain confidence that they, like their mentors, can grow in new ways. They also help fathers and mothers become their family's advocates in dealing with health and social service professionals. As partners, Vanderbilt and other universities provide training, evaluation, and support to the program. Barbara Clinton was MIHOW's first director.
The MIHOW program began in 1982 with an initial grant from the Ford Foundation to the Center for Health Services at Vanderbilt University. Building on its existing partnerships with communities, Vanderbilt surveyed administrators of community clinics and service agencies in Appalachia. The survey asked only one question. If you had $10,000 to help improve the health of mothers and babies, how would you use the money? One of the most common answers was that they would use the funds to employ a local woman who would know who was pregnant in the community in the weeks and months before that woman appeared at the clinic. Recognizing the significance of this common theme, the center proposed an imaginative yet practical solution, a parent-to-parent outreach program that has now grown into more than 20 rural and urban sites in Tennessee, Kentucky, West Virginia, Arkansas, Louisiana, and Mississippi. Through a partnership with others, such as the University of Southern Mississippi, several additional sites are being added in other states. Over the years, mothers have told us what a difference MIHOW has made in the health and well-being of their families.
La visitadora de MIHOW me ha ayudado de muchas maneras, grandes y pequeñas, desde consejos de nutrición para toda mi familia hasta cómo ayudar a mi niño de 3 años a aprender a ir al baño. Después de mi segunda embarazo con Camila, yo estuve muy deprimida y triste y la visitadora de MIHOW me ayudó con consejos para poder pasar esa situación difícil y me dio la confianza de que yo soy una buena mamá y que lo puedo hacer bien.
MIHOW mothers scored significantly higher on nationally recognized scales for mother-infant interaction, affection, and stimulation. This means that by working with MIHOW, parents make a deeper connection with their child that leads to the joy and attentiveness that good parents discover. Not surprisingly, these scales have been positively correlated with later IQ scores and school performance. An important study was sponsored by the Ford Foundation. This study showed that MIHOW mothers had 1/3 more prenatal medical visits and started prenatal care more than 1 month earlier than a comparison group. Another study was sponsored by the Bernard Van Leer Foundation. It showed that MIHOW participants were significantly more likely to know how to get help for themselves or others coping with alcoholism, drug abuse, or depression. These efforts are now being recognized from beyond their individual communities. MIHOW's record of success spans more than 2 decades. This success has led to awards and recognition from foundations, state and federal governments, and advocacy organizations. MIHOW is a good investment. MIHOW trains parents in their own neighborhoods and their own homes to recognize and build on their strengths as they address the challenges of family life. MIHOW workers bring hope and skills to mothers, fathers, and children with scheduled checkups, discussion sessions, and the encouragement of good lifestyle choices. Thousands of healthy babies, competent and involved mothers, better use of community services, healthier lifestyles for all the family. The MIHOW approach strengthens communities too, because confident and involved parents become involved in their communities. As writer Alvin Toffler observed, parenthood remains the greatest single preserve of the amateur. But with MIHOW's network of assistants, no one must face parenthood alone.
If this program hadn't been in place, I would have been lost.